Hi guys, welcome you all to our session number 4, and this will be the amalgamation now of your PNLE questions versus your PNLE options. And in here guys, in your session 4 by the way, this is just actually simply as your, ang tawag nila dito is your test taking strategy. But you know what? It's not test taking strategy as a whole if it has a different signs or iba-iba yung atake. Okay? We can't have a single most test taking strategy. Okay? Iba-iba po ang test taking strategy, bawat estudyante, iba-iba po ang test taking strategy, depende yan sa lakas ng estudyante. Depende sa strength and weaknesses niya. And wala pong unified test-taking strategy. And I think this session number 4 will be very, very short. However, this will be very comprehensive. Okay? Because again, napagdaanan na natin ang ating mga concepts about the questions and also the concepts of your options. Again, let's now try to combine sessions number 1, 2, 3 learnings. Okay? So, again, PNLE is easier when you know how to deduce questions and familiar with the types of options. Mas madali na, however, I'm not giving anyone false hopes here that when I say it's easier if you're prepared. And that's a basic concept of life. Kapag handa po tayo, wala pong mahirap para sa atin. Okay? So, that's what I'm trying to say. Okay, so PNLE questions and options relationship is just a matching type of examination. So, when we were in preschool, kinder, hanggang elementary days, high school days, and even in a college, we've faced the matching type of examination. So, ganun din po ang PNLE. It's just a matching type of examination. So, what I'm trying to say here is that kung ano yung question, hanapin mo lang ang katugma sa option. And that's the correct answer. Okay? It will increase our PNLE success. Okay? And also, again, do not think outside the box. Apply the plain meaning rule. Okay? Wala nang extra mile. However, use critical thinking for cues or for questions na may mga clues which needs extra mile of analysis or thinking. But kung hindi kailangan, okay, huwag mag extra mile of thinking. It will lead you to wrong option or wrong answer. So, wag na magpatumpik-tumpik pa. Let's have some examples here. Now, when assessing a patient with Guillain-Barre syndrome, the nurse would anticipate to assess which of the following. Now, I will not be anymore putting the marker whether this part is your body of the question. Alam na natin yan. This part is the hint of the question. Alam na natin yan. Now, invisibly, let's imagine. When assessing a patient with Guillain-Barre syndrome, it's giving us the situation, it's giving us the condition, the disease of the patient. Alam na natin that it's the body of the question. So, when assessing the patient with Guillain-Barre syndrome, the nurse would anticipate to assess which of the following signs, okay? Or assessment. Simple yung tinatanong dito. Sabi ng body, the nurse would anticipate to assess which of the following. Simple yung pagkakatanong is ganito lang. Alin sa mga sumusunod ang makikita sa Guillain-Barre or GBS? Okay, sabi sa letter A, ascending paralysis. Letter B, descending paralysis. Letter C, total blindness. Letter D, none of the above. So again, this is just a matching type. Every question in the PNLE is a matching type question. Guillain-Barre syndrome, hanapin mo lang sa option kung ano yung makikita natin sa GBS. And in here, I've taught you guys about incompatible options. Kapag sinabi natin incompatible, yung hindi pwedeng nandyan sila. Why? Because nag-aaway sila. And I said that most of the time, nasa sa kanila ang tamang sagot. For this one, let's eliminate letter C and letter D because total blindness is not actually seen in your Guillain-Barre syndrome. What's in Guillain-Barre syndrome or GBS is ptosis. Okay? Ptosis and not total blindness. Okay? So letter D, none of the above. You also eliminate that one again because there are two opposing forces for this type of question. Okay, letter A, ascending paralysis. Letter B, descending paralysis. So kung mapapansin natin, nag-aaway yung dalawa. Okay? So either of the two is the correct answer. So dito, for the correct answer here is actually letter A, ascending paralysis. So Guillain-Barre syndrome is a type of neurologic disorder wherein it is manifested by your ascending paralysis. So what I'm trying to say here, ibig sabihin nun, is that ang Guillain-Barre syndrome po, ang kanyang, may paralysis sa Guillain-Barre, pero yung kanyang paralysis na nagsisimula po sa lower part of the body, in the lower extremities to be specific. That's why pataas siya, it's ascending paralysis. Okay? So, A is the best answer. Again, that's number one. Let's have another example. A 43-year-old female was rushed to the emergency room after fainting. Another nga pala, another hint ko sa inyo, for you to be able to understand each question in the PNLE, you translate every question to the most comfortable language or dialect, okay, na meron ka. Kung hindi mo maintindihan sa English, use Tagalog, you use Filipino, you use Ilonggo, Bisaya, Waray-Waray, Kapampangan, Ilocano, Ilonggo, everything guys. Okay? Kung yun ang mas makakatulong sa inyo for you to be able to land to the most precise and most correct answer, okay, you use languages na hiyang ka. Okay, bakit? Because actually, the reason also why some, okay, fail in the NLE, it's because of semantics. Hindi nila maintindihan, okay, ang some terms that's being used, in the exam itself because the platform that's there, it's English. Okay? So, while doing assessment here, simple lang, may isang babaeng 43-year-old na admit sa emergency room because of fainting na himatay. While doing assessment, Nurse Linda, okay, knows that which of the following should be cautioned to avoid false high results on taking blood pressure of the patient. So, whenever you have this situation wherein you will be asked, okay? So, false high na false low. Yun yung situation dito no? So, these are your earring, okay? Earring techniques or yung pagkakamali natin in taking the blood pressure of the patients. Okay, sabi sa letter A, loosely putting around the upper arm. Okay? Around the upper arm, the cuff. Simple lang. Whenever you are asked of this, just imagine yung paborito nating teleserye, okay, sa kahit na namang channel. Yan. So, parang, di ba may mga sessions or mayroong mga tagpo na kung saan may sinasakal. Okay, just imagine, nandun tayo sa scenario na yun. Ang pagkakasakal doon is like application of the BP cuff, okay, sa pasyente natin. So, kapag mas mahigpit, ibig sabihin, mas mataas yung pressure. Okay? Kapag mas maluwang yung pagkakasakal, ibig sabihin, walang masyadong pressure. So, ganun lang ang konsepto nun. So, for letter A, kasi yung tinatanong dito, to avoid false high, ibig sabihin, alin daw sa mga sumusunod ang gagawin natin para maiwasan natin should be cautioned to avoid false high results, okay, on the patient's arm. You know what, when you put the cuff loosely, it will not cause you false high. So letter A is wrong. Letter B, allowing the arm to sway below the level of the heart. But B, letter C, the arm is placed in a hospital table too elevated than the patient's bed. Maybe. Letter D, the cuff is deflated very fast. Again, letter D, you eliminate this one. Why? Because, again, kapag yung pagkakasakal, mabilisan lang, nirelease ka agad yung kamay ng bida sa kontrabida. So, eventually, okay, wala nang pressure. So, now, the battle is between letter B and letter C. So, you need to remember this one, that letter B and letter C is actually, if you're going to notice it specifically, they're incompatible. So, letter B and letter C, tandaan niyo, allowing the arm to sway below the level of the heart. So, ang pivotal landmark po natin dito is the level of the heart. Sa letter C naman, the arm is placed in a hospital table that's too elevated than the patient's bed. So, ibig sabihin, ang kamay dito sa letter B ng pasyente, kung saan nilagay natin yung cuff, is below the level of the heart. Okay? While yung letter C naman is too elevated. Masyado lang siyang mataas. Okay? So, ganito guys. Kapag saang situation mas mahihirapan si heart, okay, to pump, okay, the blood all throughout our body. Okay? Sa mas mataas ba o mas mababa? Remember, kapag mataas, okay, kapag mataas yung ating pagkakalagay, okay, ng ating BP cuff or yung kamay natin is too elevated, remember that the heart will try to pump more. It's because nga mataas, no? Okay? So, ibig sabihin, mas nahihirapan yung heart. Upon the other hand, kapag lower naman class, okay, it's just easier. So, mas mababa yung pressure. So, the best answer for this one is, of course, when the patient's arms is actually swaying, okay? Not swaying, no? When the patient's arm, no, okay, is placed higher or too elevated than the patient's bed. So, mas mataas po ang pressure dyan. Why? Because the heart is trying to pump more. It's because mas nahihirapan siya. Okay? So, for here, C is the best answer. For letter B, mas madali lang eh. The pumping is just easy. Okay? So, C for this one is the best answer. Another example. A pre-gravid patient was admitted to the OB ward on your shift. Okay, may na-admit daw na pasyente sa OB ward and you were there, and upon receiving, you've read in the diagnosis, Hydatidiform mole. Hydatidiform mole is one of the complications in your obstetric nursing, and it's a condition wherein walang lumalaking baby, walang developing baby. Rather, anong meron? Those are just trophoblasts, okay, or the grape-like structures. So, which of the following assessments would you not expect from the patient? So, may hydatidiform mole daw, tapos alin daw yung hindi makikita? Simple lang. Okay, which of the following is not assessed, okay, in your hydatidiform mole? Letter A, excessive vomiting. Letter B, rapid fundal height growth. Letter C, hyperemesis gravidarum. Letter D, sharp abdominal pain. Now, notice, letter A and letter C, they're actually the same. So, kapag sinabi natin excessive vomiting, too much na pagsusuka. Hyperemesis, from the word itself, letter C naman, hyper means mataas, emesis means pagsusuka. That's why your metoclopramide is an anti-emetic drug, okay, or anti-vomiting drug, okay? So, hyperemesis, too much vomiting. Gravidarum means pagbubuntis. So, letter C means ang masyadong pagsusuka sa panahon ng pagbubuntis. So, letter A and letter C, pareho lang sila ng meaning. So, again and again and again, you can't have two correct answers in a very simple type of question. Okay? At hindi mo rin pwedeng istorbohin yung proctor na nasa room ninyo. Okay? At hindi ka rin pwedeng magreklamo sa PRC at that time because, again, you are asked to answer a question na may tamang sagot. Okay? A and C, you eliminate those two again because they're identical. Okay, between letter B and letter D, remember here that when you try to eliminate now the two, okay, so the correct answer for this one is letter D, sharp abdominal pain. Okay, in your hydatidiform mole, it's, according to the book, it's actually painless vaginal, okay, bleeding na yung kulay dito is prune juice, okay, there could be pain but not sharp abdominal pain, okay. So, because sharp abdominal pain is a pathognomonic sign for your ectopic pregnancy. It's sharp, pain-like pain. Yan. Okay? It's a sharp, knife-like, rather. Okay? Sharp, knife-like pain. Okay? So, rapid fundal height growth, letter B, you cross it out. Why? Because it's actually a sign also of your hydatidiform mole because mas mabilis yung paglaki ng ating fundal height, no, or pagtaas ng fundal height. It's because wala ngang developing baby, purely trophoblasts po yung nagde-develop. Okay? Kasi yung hinahanap natin dito, not. Okay? The not. Remember that one. It's capitalized, not expect from the patient. Next question or next example. In the community, you've been asked if what's the best use of garlic or bawang as an alternative medicine or herbal plant. Alam na natin to. But let's try to analyze the options given here. Letter A, it is used for all types of parasitic diseases. Letter B, it is used for helminthiasis only. Yan. Notice letter A and letter B, sinabi natin sa session 3, they have these very dangerous terms. Okay? When you say all types, that's an all-encompassing term, you don't answer that one. Most of the time, it's a wrong option, it's a wrong answer. Why? Because that's a dangerous term. Okay? Or unsafe term. Letter B, it is used for helminthias only. Dangerous term then. So, you eliminate letter A and letter B, and here, another hint also, notice that letter C is just identical to letter A. Okay? Pareham lang sila ng ibig sabihin actually. Okay? Lesser lang si letter C ng value. It's because wala siyang all. Okay? So, it is used as an alternative for parasitic infection. And actually, letter B is also the same. So, dito, you don't just have two the same options, tatlo pa. Okay? So, making letter D as a unique option. So, alam natin yan that garlic or bawang is used for hypertension. In fact, when I was still at the emergency as an ER nurse, too many times po ako naka-receive ng mga hypertensive patients na amoy bawang. No? It's because it is accepted by the Department of Health as an herbal plant or herbal medicine. Okay? So, letter D is the best answer for this one. What is the end goal of community health nursing? Yan. These options has been given in your session number 3. A, to make people self-reliant. Letter B, to capacitate the community. Letter C, to exercise positive change. Letter D, to improve quality of life. You know what? When I was in the nursing school, ito yung mga type ng question talaga na naiinis ako. It's because parang lahat tama no? Pero may pinakatama talaga sa kanila. And that's the term that's always been used by my clinical instructor. But hindi po naituro yung umbrella option. So, now, notice that there is an outstanding option here, okay, which is actually the correct answer for this question. So, let's try to examine. What is the end goal of community health nursing? Could be to make people self-reliant. What for? To improve the quality of life. Letter B, what is the goal of community health nursing? To capacitate the community. What for? To improve the quality of life. Letter C, to exercise positive change. What for? To improve the quality of life. So basically, this question is just actually ending up to a certain option na kung saan it's an all-encompassing option. Okay? Letter D, to improve quality of life, is the correct answer for this one. And that's what we call, again, as your umbrella option. Okay? Sila yung nanay at meron siyang mga anak na mga iba pang options. Kapag merong ganong type of option or choice, of course, that's most of the time that's a correct answer. Another example, what's the end goal of research? Ito masyadong lumalabas to no in your NP5, NP1. Sabi sa letter A, to generate new knowledge, to improve the quality of life. Sabi sa letter B. Letter C, to make people capable. Bakit ka nga ba nagre-research? Yes, to make people capable. Okay? Bakit ka nagre-research? To generate new knowledge para may bagong kaalaman. Sa letter D, to conceptualize new processes. Yes, to make new protocols, to make new patents, to make new ideas. So, what is the end goal? Why do you do those things? Why do you do research? Of course, simply to improve the quality of life. Para mas mapataas pa ang level ng kalidad ng buhay. Okay? To improve the quality of life. That's the mother. Okay? Among the options here. So, it's an umbrella option. Okay? So, basically, we all know these things. And minsan hindi lang natin nare-realize that this is the right way of deducing everything in our examination. So, now let's talk about SATA. Again, whenever you are asked of SATA type of question, just look at the option. Wag munang magpanic, it's organic. Okay? So what I'm trying to say is that SATA option or SATA question is just a true or false type of question. Okay, so as the options. So count the options one by one and we try to analyze if they are true to the questions or not. Then eliminate if they needed to be eliminated. Tanggalin yung mga hindi relative, okay, or related to the question given. Okay, say for example here, you were temporarily assigned at the ER when a 12-year-old child was rushed due to sudden asthma attack. So probably, you are an OB nurse, nasa ward ka, tapos biglang nagkulang ng nurse, may umabsent sa emergency room at ginawa kang float nurse. Yan. After taking first interventions, yan, may ginawa ka na. You ask if what triggered the attack. Which of the following, if verbalized by the companion, would you list down as possible causes? Okay, select all that apply. That's the dangerous line. Hiyang nasanay, which of the following, if verbalized by the companion, would you list down as possible causes? Select all that apply. Letter A. Simple lang din tanong dito. Alin daw sa mga options ang nakakapag-cause ng asthma? Okay, letter A, smoking. Letter B, allergens. Letter C, stress. Letter D, protein-rich diet. Letter E, cold temperature. Letter F, hypertension. Ay, naku, napakadaming options. So again, sabi ko, take the options one by one, read between the lines, and eliminate those things which needs to be eliminated. So for this one, this is actually a way, there's a famous mnemonic of causes of asthma triggers na asthma din. Okay? So, smoking, is it an asthma trigger? Yes. That's why sa may mga asthmatic na kabataan, bawal talaga yung may nagsisigarilyo sa bahay, no? Because it can cause, okay, it can be a trigger. So, allergens, yes, what type of allergens? Yung mga fur or balahibo ng ating mga pusa, aso, even yung mga pollens po ng mga seasonal plants, okay? Yung mga halaman, meron pong mga hyperallergenic na mga halaman, no? Okay, so food as well, no? Manok, those are allergens, okay? So, allergy, it can cause asthma attack. Stress, yes. Okay? Protein-rich diet, not so. Not so. Cold temperature, yes, because temperature change. Again, A, allergy, S, smoking, it can also have stress, it can also have sports, yan. Temperature change, hazards, microbes, anxiety. So, for hypertension, it's actually not so. Okay, not so related. So the best answer for this one is A, letter B, letter C, and of course your letter E. Okay? So this is the way to deduce your SATA questions. Again, understand PNLE options plainly. Do not give extra meaning to each options. This will lead you to over-rationalization. Read confusing options carefully and apply the method, and do not stress yourself on options you don't know at all. May mga pagkakataon na kung saan makakatagpo ka ng questions that never mo nabasa. But do not panic. Just apply what you've learned here. Answer it scientifically and take the next item which might be easier for you to analyze. Okay? So, another thing also, it's very, very advantageous for those who've been using Scantron sheet in their nursing school because iba po ang questionnaire natin sa ating shading na paper, okay, in your NLE. At gumagamit na rin dito yung mga ibang nursing schools. And it's very good if meron kayong ganun. However, kung wala po, magiging challenge sa inyo. So, dapat masanay tayo ng proper technique. Okay? When you read its question, you know how to transcend it, okay? Or to transcribe it to your Scantron sheet now. You shade it properly. And then, merong mga estudyante na mas hiyang sila sa one by one. When you read the question, you have your answer, you shade. Pero ang problema doon, class, is that there are some times wherein you might be, okay, land into this situation wherein nasa 100 na yung question mo pero 99 ka pa lang sa shading. And it's very different and it's very difficult for you to trace back kung saan ka nga ba baka lang mayroong kang na-miss na question. So, my suggestion is that you take 5 questions each and then you transcribe it para mas na-revisit mo, okay, yung papel mo. Or you can have every 10 question and then 10 question you read, you answer it temporarily, maglagay ka ng markers, and then you shade it here. Okay? So, that's it. So that, technically din, hindi tayo mahirapan. So, sir, what if the technique is not applicable to some questions? And of course, it's not all the time that the technique, the top score method or the top score technique, no, will be applicable to all questions. And that's true. However, if this happens, take and answer the questions normally. Wala kang ibang gagawin. Okay? Halimbawa, if it is a calculation, if it is a drug calculation question, you calculate. Okay? Use your calculator. If it asks for who, you answer who. For theorists, halimbawa, you answer the name of the person. And if it asks for when, na hindi ko alam, no? Kasi tinatanong pa rin to eh. Sa Philippine Nurse Licensure Examination, you write down the specific date, okay? Or specific period of time in the history of nursing profession in the Philippines. So walang extra mail na gagawin. You just need to relax, okay? And then find the right answer normally. Okay? So again and again, do not do any over-rationalization for these instances. Okay, guys? See you on our next sessions. Thank you.